infection is introduced into that anal gland, and that infection and abscessation has nowhere to go but to the outside. So we do see that quite regularly as well, where a dog comes in with a bleeding pussy wound on their rear, and quite often it is an anal gland that has burst to the outside. And that is obviously incredibly painful prior to it bursting, but then obviously once that has burst, now you've got a big open wound in the skin as well. And once again, it's not in the most hygienic of areas, so they can get quite funky if left untreated. So
a very warm welcome back to the Paws Effect Podcast, Sister Cat.
Thank you for having me.
This stemmed from the fact that I saw quite a few of these on your list. Mm-hmm. You see quite a few anal gland cases.
Yes, I do. I get the smelly end.
You get the smelly end of the deal. And whilst, and I'm just, for interest, whilst a lot of vets are like, oh, come on, no, it's a stinky job.
Yeah.
I used to love these consults.
Yeah.
Because they're quite practical and it's quite generally straightforward, but when they're not straightforward, they're obviously, and we're going to talk about this, when it actually becomes a bit more complicated than just the anal gland expression.
Yes.
So we're going to talk anal gland disease, just generally what the anal glands are, and provide some clarification. If you have a dog that suffers with anal gland problems.
Absolutely.
Because it's a dog problem, isn't it? I mean, we very rarely
For the most part, yes. So I have had a couple of cats over the years, but it's uncommon in cats, generally only seen in our very obese cats.
Yes.
So yes, for the most part, it's a dog problem.
Okay. And do you tend to see this in larger breed dogs or smaller breed dogs?
Predominantly small breed dogs, very rare in large breed dogs, but not impossible.
Yeah.
So.
And we see, and we're not necessarily going to cover this part of the thing, but we see some sort of anal furunculosis type things in some of the German Shepherd type breeds.
Yes, yeah.
But we're not necessarily going to discuss that today.
Yeah.
Stick to anal glands.
Yeah.
So let's start right at the beginning. What are anal glands?
Yeah.
And why do dogs have them?
Yeah.
And cats. Sorry.
So, I get asked this question a lot because someone will be discussing in consult with me here, like, oh my gosh, their dog has such a weird smell. Like, and every so often there's like this fishy smell on the couch and they cannot understand. I'm like, oh yeah, no, that's the anal glands. And like, the anal what? So basically, as the name says, it is two little glands on the side of the anus, and they secrete a putrid, foul-smelling liquid, which generally expresses itself. These little glands express themselves when the dogs defecate, and it is sort of basically Facebook for dogs. Yay. So it is like a little message left, and that is why dogs do tend to go and sniff other dogs' feces when they're out and about. It's like it's a little message of who was there and what was happening. And that is basically what anal gland is. It's a very stinky, smelly juice that comes out the back end when the dogs have a poo.
So what is actually happening when this happens? Like you say, the case example, when they relax and they're lying on the couch. Yeah. Why does this happen? So
if the anal glands are not expressing fully when the dogs defecate, they can get overfull, and then something like a fright or over-relaxation, these little anal glands just sort of leach out by themselves or suddenly explode all over the place. And that is generally what the owners are experiencing, is that it's not outside. There's been an incident on the couch, or like the dog's relaxed so much he's fallen asleep on the couch, and all of a sudden there's a really horrible smell. And it's just from that complete relaxation or overfullness of the anal glands that they do leach out themselves.
So, I mean, I want us to go through sort of normal anal glands and then being full or impacted. So we'll cover that. I want to go through what happens if there is some inflammatory issue. We'll cover that in terms of, and then we also have the other end. I thought we just cover that first, so we wrap it up. We also have the possibility of anal gland tumors. So these are generally the cases that you will then refer on to the vets.
Exactly. Right? Yes. Yeah. So if anything is beyond abnormal or beyond the scope of what I'm able to assist with, then absolutely that gets referred to the vet, and further testing or diagnostics will be done going forward with the vet.
So let's just talk about that possibility. So, I mean, we're going to cover this. We won't tackle this quite yet, but what we're referring to now are tumors, adenocarcinomas, typically often presenting with other clinical signs like increased urination and thirst and things that affects calcium stasis in the body. And then these are not generally painful, but they are enlarged what feel like lymph nodes, right?
Yes, yeah, very firm. And so backtracking just a wee bit, like if we were to express a normal gland, anal gland, it is just like sort of like a feeling of a water balloon. You're able to palpably feel it and express it out. Whereas when we've got a tumor, it is very firm. There's not much give. And then that's obviously indicative that there's something very wrong going on there. And that is then when I refer to the vet that this needs further investigation and something not quite right.
Yeah, and for clarification, these are worthwhile having looked at because they can be surgically removed.
Absolutely.
They will ultrasound, they possibly will take biopsies, establish what this is. You know, is this just an enlargement or is this like an actual tumor?
Yes.
So I just wanted us to put that to bed because our discussion today is about the normal impaction. So let's talk about impaction. Let's start with the one where there isn't necessarily any inflammatory process.
Right.
Why? Why do anal glands become impacted in our particularly small breed dogs?
Yeah. So for the most part, when we have impacted anal glands, it's generally in our overweight small dogs. And it is generally small dogs that are overweight. They get away with murder. They get a bazillion treats because they're cute. And we see a lot of obese small breed dogs. And they then have quite a significant fat pad between the muscle and the anal gland itself. So when they are going through the motions of defecating, where that muscle would normally sort of contract and express the anal gland, you now have a large fat pad there, so it's not able to express that anal gland. Also, with them being overweight, they're generally not very fit and active dogs, so they might actually lose a lot of the muscle mass in that area as well, which could also just be the case in our senior patients that are losing muscle mass due to age or protein loss. But it is generally to do with that muscle action in the back that is no longer functioning normally.
So it changes the pressure, obviously, of the ability to naturally excrete.
So with those guys, we generally then see these anal glands that are filling up and filling up and filling up and never getting expressed. And the owner will then report that either there's a funny smell or the dog is rubbing its bottom along their beautiful Persian carpets. And a lot of the times people actually think that this is worms. So they'll deworm their dog over and over and over again and not sort of getting to the bottom of the problem. And they'll come in and express that, the dog's scooting. We call it scooting all over the floors. And it is almost always impacted anal glands. So then we give that a good express. And also, for the most part, it is easily expressed. It's quite fluid secretion, so easily expressed out. And we just do a little tidy up and a deodorant spray, and everyone's good to go.
Oh, your consult room is so fragrant. So let's. Sometimes what we find before we go, because I do want us to cover this in terms of even if you can advise us how you do it. But before we get to that step, sometimes you find that these dogs, other than the scooting, and because it's itchy, right? It's uncomfortable and they're trying to relieve this pressure.
Yes.
Will also want to lick.
Yes.
Is that difficult in like you say, an overweight or obese dog to get to that?
They can't reach. Yeah. So, it is sort of quite an erratic little behavior, trying to scoot along the ground and trying to get to their bottom, but they can't reach. And everyone's just, oh my gosh, what is going on? They just envision that there must be worms coming out. But shame. It is very uncomfortable. And, aside from it being itchy and irritated, you can just imagine what it feels like to have two walnut-sized little bags at the back that aren't going away.
Shame. So, and any pressure that builds up will cause those nerves to feel very uncomfortable.
Yeah.
So we sometimes see them present, and you see them sometimes as hair loss, right? Or, sort of a wet bottom, or some people think that their pets have got diarrhea because they're smelling it. So often these are cases where you think you're seeing another condition and it happens to be the anal glands.
Almost always, actually.
Yeah. Oh, really?
Because, first and foremost, I find that a lot of clients don't know that anal glands exist and are a thing, and let alone how they present as a problem. It's hair loss on the back or rubbing their tail. They think they've got an itchy tail. biting at their back legs, but it might just be that they're not able to reach the bottom, that they're able to reach the back leg, and that's the closest second best option.
It's itchy. I'm just trying to get this close.
Yeah. And once they do scoot and manage to express some, as you say, they can have a wet bottom as well, because they have actually managed to get some of the anal gland material out.
Yeah, or they're licking loads, and it's just this massive. And they can get secondary issues. Obviously, now before we talk about the actual inflammatory process of the anal gland, they can get like a dermatitis or like a hot spot.
Absolutely.
We see them with acute moist dermatitis because of...
Yeah, they're introducing bacteria from their mouth into the area and irritating the skin by gnawing at it, licking at it constantly, introducing that bacteria, and off goes a hot spot.
Yeah.
And a nasty dermatitis. And now you've got 2 problems for the price of 1.
Definitely worth trying to deal with it early on. Hi there, pet parents. This is Dr. Cara, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little ones strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints, and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? Ultra Pet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. So let's talk about the process before we get to our inflammatory issues. There are 2 methods that people generally use, and some owners are quite invested in understanding this. So I thought it would be quite nice for you to give advice as to sort of how you do it, because there are certain owners where if this is recurrent, and we'll go to that too about the advice on doing it.
Yeah.
But if this is recurrent, you may want to show an owner how to do it. So can you take us through the process of how you would express, where you find them, how you would express them?
So if you sort of imagine the anal area of the dog, it is at about approximately 4 o'clock and 7 o'clock on a clock. Those are where the anal glands are situated, just below the anus. Often you can see a little bulge in that area if they are quite full, but you can certainly always feel them there. In general, a normal expressed happy anal gland, I would say, is generally sort of about the size of a couple of peas. They're not huge glands, but when they're overfull and impacted, they can quite easily be the size of a walnut, and those are glands that definitely need to be expressed. So how we do it in a hospital or veterinary clinic situation is we put gloves on because it's a very smelly situation. And we use a little bit of lubricant just for patient comfort, obviously, and we do insert a finger up the dog's rectum. And then, so that would be our index finger, and then with our thumb, we feel the gland from the outside, and we then basically gently milk the contents of the anal glands twice, well, each gland. And that quite literally comes squirting out at a high velocity. But what I do want to sort of mention on that is it is a gentle milking motion. So I have seen quite a few problems on people wanting to do it at home, and they're doing like sort of a squeeze situation, even if they're doing it themselves from the outside, and need to be careful of that you can then actually cause a lot more irritation and bruising in the area. That if it's not coming out in a gentle milking motion, then rather stop and get to your vet clinic if you are attempting to do this yourself at home.
Yeah. So gentle pressure. And I mean, if anything, like you said, that milking motion is starting sort of towards the back, and as it empties,
you're sort of coming along the gland itself. Yeah. I sort of want to envision like a water balloon, and you're sort of milking it out towards the top of the water balloon, because it is also that teardrop shape. So you have a big round bottom and a very small exit point. Yeah. So milking it gently out. Yeah.
Okay.
And you can just imagine if you're putting a lot of pressure on that, and for example, if it's really thick anal gland content, you can cause a bit of damage if you're trying to put massive force on thick material trying to get out of a very small little hole. Uncomfortable, bruising of the area, not going to be pleasant.
No. And well worth, and I don't know whether you do it, but I certainly, putting cotton wool over the area.
Yes.
Standing out of the way.
Yeah, absolutely. So when you are doing sort of inserting a finger up the rectum and doing that, as I said, it is coming out at high velocity. So we do have like a cotton pad over the anus to sort of catch all the content, because it literally does. It goes squirting everywhere and hits all the walls. But for the other way around, that if I were to show a client how to do it, is sort of placing your fingers at the glands on the outside, not putting your finger up the dog's rectum, and gently manipulating from the outside, and you're then able to do both glands sort of at the same time. Yeah. Once again, not doing the squeeze, multiple squeezings. It is also one milking
and
motion.
Gentle pressure.
Yeah. And I've then even said to my clients, take the dogs outside into the garden, point them at a flower bed, and you can lift the tail and sort of do it from standing next to the dog, as opposed to being it firing straight at you, because then you can just fire it into the garden. So you're a little bit safer there.
Yeah.
But once again, I would recommend using gloves, because
that smells.
It's like being raccooned, like you. It stinks. Everything stinks that it comes into contact to, and it takes a fair amount of hand washing to get it off of you if it has touched your skin.
It's pungent.
Yeah.
So there's a lot to be said about what we gain from looking at that. So I don't know, this is, thinking back, it's been a while since I've expressed anal glands, but to the days when I did, of, I mean, it's so gross. I imagine it now with a kid looking at the snotty tissue. It's so, sorry, we're having such a wonderful conversation today. But in the same way, we often have a look at the contents,
yes.
Not because it's some gross, sick thing we like to do, but because the contents are telling us or giving us further information about whether it's healthy or whether there is actually a problem.
Correct.
So can you tell us some of the signs? Perhaps let's take it into what would be abnormal contents and what would give you an indication that there is actually an inflammatory process and there may be an abscess or an inflammatory issue with the anal glands.
So starting off with what normal would be a light brown water consistency material. Yeah. So it's very liquid, very easily expressed, and it's just brown, smelly water, basically. When we start going down the road of things changing, we can start seeing granules, sort of like, I want to say, coffee grind type consistency within the water. Not a train smash at that point, but just indicating that we might need to just keep an eye on these glands more regularly. And that then starts progressing to a toothpaste consistency. Once we get to the toothpaste consistency, this is where the problem comes in of applying the too much pressure to the anal glands, because that is very thick and generally quite like cottage cheesy toothpaste consistency. And we are then starting to go down the realms of there being a problem.
Like an impaction.
Correct, yeah. So that can even be from the gland overproducing secretions, or the fact that these anal glands are not expressing by themselves and have now accumulated here for so long that they do start becoming quite solid.
Yeah.
After that toothpaste consistency, then we generally start getting to the point where we can actually see pus coming out, blood streaks coming out with the material, and as foul smelling as they are, they do actually get worse smelling as well. When we're starting to get infection in those anal glands, it starts smelling quite putrid. So going from that consistency to then with pus and blood coming out as well.
This then now goes from being relatively uncomfortable. I mean, there are not many dogs that are like, cool, I don't mind having my anal glands expressed. So it's uncomfortable to, this is really painful.
Yeah. And at this point, we then do also run the risk of the anal glands actually bursting to the outside. So with all that pressure and possible now infection taking place in the anal glands, if that content is not able to come out, be it expressed manually or the dog being able to express it themselves, we do have a lot of bacteria in that area. So infection is introduced into that anal gland, and that infection and abscessation has nowhere to go but to the outside. So we do see that quite regularly as well, where a dog comes in with a bleeding, pussy wound on their rear, and quite often it is an anal gland that has burst to the outside.
Sure.
And that is obviously incredibly painful prior to it bursting. But then obviously once that has burst, now you've got a big open wound in the skin as well.
Yeah.
And once again, it's not in the most hygienic of areas. No. So they can get quite funky if left untreated.
Yeah.
So
you definitely want to be getting some treatment on board.
Absolutely.
So obviously when I know that these are some cases where you may again refer to a vet, but just generally, what are the kind of things? Are you treating these with topical treatments, or are there systemic anti-inflammatories?
So we would definitely be including systemic treatment, so oral antibiotics and anti-inflammatories, both to control the inflammation and the pain associated with it. But then, yes, as treating it as an open wound, because we wouldn't stitch those wounds closed or anything like that. We do want all of that material to drain out until such a point that the antibiotics are actually starting to take effect and getting rid of the infection. So I wouldn't say we necessarily treat topically, but we would want to keep that area as clean as possible. Sort of cleaning away any material, possibly putting an antibacterial agent over the open wound, but at the same time, there's going to be so much draining out that it can be a little bit pointless at times because it's just all getting smeared away.
So there are pets that have just recurrent anal gland problems. And so whether it's that they keep getting impacted, they are needing expressing frequently, or they're getting sort of abscesses or infections quite a lot. What is your general advice before we go to what you can do about it in terms of longer term management? But what is your general advice if people come in and they go, "Oh, please, can you just express my pet's anal glands?" I'm asking because from my experience, having had a dog that sort of occasionally would express them on the couch or wherever, I found that the more that I expressed them, the more they needed to be expressed. Is this something that you find in your patients, that unnecessarily expressing them unless there is a problem, or unless you have frequent bouts of them being inappropriately, I suppose it's not that kind of term. Express it at the time
accidentally.
That the more they were expressed, the more they needed to be expressed. Is this something that you come across, or do you generally advise owners because it's stinky and it's inconvenient?
So I mean, I'd say it can go both ways in the sense that if we've got very irritated, over-secreting anal glands, so I do feel that they would then need to be expressed, but doing the expression itself can also be causing irritation and inflammation each time we do it, which then sort of increases the hypersecretion tenfold again. So you end up going into a bit of a vicious cycle. So I do also then try and have a chat with the owner just to, with regards to as to what the dog is eating, because quite often it can also come down to they're either eating a highly concentrated diet and there's not a lot of fiber to it, and they've got these teeny tiny little poos, and they're not actually sort of able to express those anal glands, just from the actual size of the fecal matter is not big enough to warrant the muscle contraction. Also, if the dog constantly has diarrhea, the anal glands are going to be a problem. So if it is sort of turning into one of those vicious cycles, you sort of need to backtrack a wee bit as well and see if we've got other gastrointestinal issues of some sort, or a lack of fiber in the diet.
Or like you said, the weight.
Yes.
So often these are ones that I hear you recommending them to, in your gentle way, to go.
Chunky monkey needs to lose weight.
It's time.
But then there are also just some dogs, some breeds are predisposed to, not having great muscle mass over that back area. And, they are just going to require regular anal gland expression, that there's not necessarily a lot of inflammation or infection going on, but that they do just need quite regular anal gland expression.
So you start with the let's have a look and see if we can change the diet. So more fecal bulking diets.
Yes,
that, like you said, just rather than those little poos that actually.
Yes, yeah.
And obviously fiber is really important in terms of gut health, as we know, in terms of our microbiome and our microbes within our gut.
Yes.
There are lots of benefits, not only the fecal mass, but benefits to health.
Yeah.
So diet adjustments if that's required.
Have a look at it and see if it's a concern. Yeah, because quite often they haven't even realized that their dog has had diarrhea for months on end, or just a very loose stool, because it doesn't have to be watery diarrhea pouring out of the dog, but if it's cowpat type stools, that's also not going to be enough to express.
And you also want to, I see you also going like, when last did you deworm? Because you don't want that to be don't
want to be caught off guard.
You're scooting, because those two things do sometimes present in a similar way, but you also you don't want a reason either for the fecal contents not to be appropriate,
exactly,
but also for them to have anything that's causing any inflammation or any discomfort in that area. So let's talk about, we've tried all these things. You've got them to lose some weight, you've got them maybe to increase muscle mass by increasing exercise, they've got form bulking, nutritional interventions.
Yeah,
they just have problems over and over and over. What is the advice generally?
And that is possible. There are a lot of dogs that end up going down that road, and then surgically removing the anal glands would probably be the next step. And it is a common surgery. It is done quite frequently, but it is not a surgery that comes without risks. So worst case scenario, these surgeries can accidentally cause fecal incontinence and sort of a lot of other nerve ending issues in the back area, because where those anal glands are situated, there are a lot of nerves and muscles involved. So it is not a surgery that we just recommend to everyone who has had their dogs needing anal gland expression a couple of times. We really have to go down the whole road before we start.
Keeps getting impacted. Yeah. It's difficult to express.
Constantly having anal gland abscesses.
Inflammation and so on and so forth.
Yeah. So it's definitely something that we would recommend. It can absolutely be necessary for the benefit of the dog, but it's not something we recommend straight off the bat. We will try a couple of options before we get there, just because obviously the surgery does have a couple of risks associated with it, and we don't want to go from anal gland impactions to then a dog that is fecally incontinent and then defecating all over the place. Yeah. So
not without risk, as you say.
Exactly. Yeah.
And from a cost perspective, this is going to require an anesthetic.
Yes. Yeah.
Even down to some of the impacted anal glands where you are trying to soften that material. It's passing a little catheter into the duct. Trying to soften the material so you can express it.
Yes.
Even that it's not something you can do conscious. Is it?
No. It's very uncomfortable. Yeah. Not necessarily painful, but certainly uncomfortable. And they're also wondering what on earth you're doing, constantly fiddling around the back. But certainly the pressure associated as well with trying to get fluid into those anal gland sacs, you're suddenly creating more pressure to be able to then try and soften the content to come out. So certainly not something that we can do awake. Yeah. They would need a sedation for that.
Definitely. So what is your general advice, just on sort of parting comments, to owners when they've had the dog's anal glands expressed? How do they know when next to come and see you?
So generally, we say it's between 4 and 6 weeks that maybe we should just have a checkup. We can also just have a little feel from the outside that I don't necessarily do anything, but let's just have a look within that time frame. But most often we get reports of that when the dog is probably impacted again, is obviously the scooting behavior starts again. But, they're also just looking a little bit dull and lethargic and uncomfortable. My own dog has anal gland issues, and the first thing he does is go off his food. Aww. So he's not sick or anything like that. He just feels a bit So when he goes off his food, because he's generally a good eater, I know that his anal glands need doing. Oh, so, you'll pick up on subtle changes. It's obviously not drastic, very sickly, ill-looking dogs. But
unless there's a major
unless
infection.
It's gone completely wrong. Yeah. But sort of the standard ones that just need regular anal gland expressions, it's generally speaking 4 to 6 weeks. between expressions. Yeah.
This has been so informative. Thank you very much
pleasure.
for coming and taking time in your very busy schedule.
Back to it.
Yeah. What have you got on your list today?
Multiple vaccinations.
A lot of vaccines.
Yeah. It's that time again.
Yeah, it's time of year where people are definitely also wanting to go away and whatnot.
Yes, I was just going to say, everyone getting ready for Easter weekend. So, lots of school holidays and things. So, kennel calf vaccines, everybody getting boosted. So, that's good to see.
Thank you for taking time out.
Absolutely. Anytime. Thanks.
Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here. And boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.